If you're over 60, there's something your doctor might not be telling you, something that can make a huge difference in your overall well-being. It's a topic many might shy away from, but I'm here to be direct. If you've stopped engaging in self-intimacy, your body might be paying a price that you don't even realize. And it's not just about sexual health. The effects reach far beyond that, affecting your brain, your heart, your sleep, and even your sense of self. I'm Dr. Perriera, and over the years I've helped countless women navigate the complexities of aging. Today I want to share with you why self-intimacy is vital for your health as you age. And it's not about fantasy or indulgence, it's about keeping your body in balance, protecting your brain, and maintaining emotional well-being. There's a quiet danger when this part of our health is neglected. The effects are not only physical, but emotional and psychological too. In the next few minutes, I'll walk you through exactly what happens inside your body when you stop self-stimulation as you grow older. This could be the information that completely changes how you look at your own health. Before we dive deeper, take a moment to like, comment, or subscribe if you're ready to prioritize your health and well-being. Let's start with the first, often overlooked consequence of not maintaining intimacy, what it does to your pelvic and urinary health. When I first began practicing medicine, I wasn't prepared for how often my patients would open up about the decline in their sexual habits as they aged. A woman I'll call Carol came to see me when she was in her late 60s. She was vibrant, sharp, and healthy in so many ways. But she was also struggling with recurrent urinary tract infections and bladder urgency, things she didn't know were related to the natural process of aging. What Carol didn't realize was that sexual stimulation, even through self-intimacy, plays an essential role in maintaining pelvic health. The vagina, bladder, and pelvic floor muscles aren't static structures. They are living tissues that thrive with healthy blood flow. When arousal and orgasm occur, blood circulation to the pelvic area increases. Without this regular stimulation, blood flow to the pelvic region decreases, which can accelerate the effects of vaginal atrophy, a common postmenopausal condition. This causes the vaginal tissues to become thinner, drier, and less elastic, creating the perfect environment for irritation, infections, and pain. But the effects go beyond just physical discomfort. When blood flow slows down, the pelvic floor muscles, which support the bladder and uterus, become weaker. This can lead to stress, incontinence, leaking urine when you cough, laugh, or sneeze, or even pelvic organ prolapse. Carol was on the path to needing surgery to fix her bladder issues, something that might have been avoided if we had addressed it earlier. Self-intimacy brings oxygen-rich blood to the pelvic tissues, keeping them healthy and resilient. It's not just about pleasure, it's about protecting your body and its most basic functions. When you stop taking care of this part of yourself, the risks of infections and loss of bladder control increase, potentially taking away your freedom and independence. I've seen women become afraid to leave their homes or feel anxious during everyday activities because they couldn't trust their bladder. This isn't just about physical discomfort, it's about your sense of dignity and control. But the effects of neglecting your sexual health don't stop there. What happens next impacts your brain. When you stop stimulating your body in this way, your cognitive function can start to decline. It's not just about losing memory, it's about losing your mental sharpness, focus, and emotional stability. Let me share the story of a patient I'll call Susan. She came to me in her late 60s, complaining not about her physical health, but her mental state. She told me, "Dr. Perriera, I don't feel like myself anymore. I forget why I walked into a room, and I lose my train of thought mid-sentence. I used to be so sharp. Is this just old age?" Many women ask themselves this same question, believing that cognitive decline is simply a part of aging. But what most don't realize is that sexual activity, including self-intimacy, plays a key role in maintaining brain health. Here's why. During sexual arousal, your brain releases a mix of neurochemicals, dopamine, serotonin, and oxytocin, all of which are linked to improved memory focus and emotional regulation. These chemicals don't just make you feel good, they help build and protect neural connections, improve blood flow to the brain, and lower cortisol, the stress hormone that can damage brain cells. When you stop stimulating your body, those brain-boosting chemicals become less frequent. Over time, this affects your ability to concentrate, process information, and even remember names or appointments. It doesn't happen overnight, but gradually, you may find it harder to stay sharp and focused. If this resonates with you, type 1 in the comments. Your engagement helps me understand what you find most valuable in these discussions. In the next part, I'll explain how the emotional consequences of neglecting your sexual health can lead to depression and emotional numbness, even in the absence of physical symptoms. But first, let's pause here for a moment. As we continue, it's important to understand how the absence of self-intimacy can gradually take a toll on your emotional health. Many women don't realize that giving up this part of their lives can lead to emotional numbness and even depression. It's subtle at first, but over time it can have a profound effect on your mood, your relationships, and your overall emotional well-being. I had a patient in her early 70s, whom I'll call Helen, who came to see me with a complaint that many women might not immediately associate with aging. She said, "Dr. Perriera, I just don't feel anything anymore. Not sadness, not happiness. Everything feels flat. Is that normal for my age?" When we discussed her life, it became clear that, like many women her age, she had stopped engaging with herself in a deeply intimate way. She believed it was a normal part of aging to no longer feel sexual or emotionally connected to her own body. The truth is, when you stop connecting with your body in this way, you're not just losing physical pleasure, you're losing the emotional release that comes with it. Orgasm, even through self-intimacy, isn't just a physical event, it's an emotional one. It triggers the release of powerful mood-boosting chemicals like oxytocin and endorphins. These chemicals help alleviate stress, anxiety, and even depression. When you stop engaging in this release, especially during times when stress, grief, or loneliness might already be present, you risk becoming emotionally numb. And that numbness can gradually evolve into something much more serious: depression. I've seen it happen in countless women. It starts with small signs. Maybe you withdraw from hobbies, or you stop connecting with friends and family. You might even begin to feel disconnected from your own life. Some of my patients have told me they stopped enjoying activities they once loved, like going to the movies or spending time with grandchildren. They didn't realize the connection between their emotional withdrawal and the lack of intimacy with themselves. The emotional numbness that follows can be dangerous. It's often mistaken for just a part of getting older, but in many cases, it's actually a result of neglecting your sexual health. And it's not something you should ignore. Depression in older women is frequently underdiagnosed, especially because it doesn't always look like sadness. It might show up as irritability, loss of motivation, fatigue, or an absence of desire. What's troubling is that many women simply accept these symptoms as a normal part of aging and never connect them to the simple act of reconnecting with themselves. But I've seen firsthand how powerful this change can be. A patient who had been withdrawn for months after reconnecting with herself through self-intimacy said to me, "I feel alive again. It didn't just lift my mood. It reminded me that I am still a woman, not just someone waiting to fade away." That simple act, reclaiming intimacy with herself, restored her sense of vitality, independence, and confidence. And it wasn't just about physical pleasure. It was about mental and emotional well-being. Many women believe that self-intimacy is no longer necessary or appropriate as they age, but nothing could be further from the truth. It's not about feeling youthful or indulging in old habits. It's about maintaining emotional balance and mental clarity. Self-intimacy is a natural, healthy way to release emotional tension and stress. It keeps your body and mind connected, and more importantly, it helps preserve your emotional health. This is why it's critical to recognize the subtle signs of emotional decline and to take action. You might think, I'm too old for this, or it's just part of getting older. But when you stop nurturing this part of yourself, the consequences are not just physical, they can be deeply emotional as well. Now that we've talked about the emotional consequences, it's time to dive deeper into how the absence of self-intimacy can affect your sleep, which in turn impacts every other part of your health. Poor sleep quality doesn't just leave you feeling tired, it can lead to a host of other health issues from memory problems to a weakened immune system. We all know that sleep is essential for our well-being, but many don't realize how connected sleep is to sexual health. In the next section, I'll explain why self-intimacy plays a crucial role in helping you get the restorative sleep your body needs, and how its absence can disrupt your body's natural rhythms in ways you might not expect. Now that we've explored the emotional and cognitive effects of neglecting self-intimacy, it's time to address another critical aspect: sleep. Sleep is one of the most essential components of your health, especially as you age, and the absence of self-intimacy can have a profound impact on the quality of your rest. We often take sleep for granted, but when it's disrupted, it can affect your memory, immune system, and overall vitality. I remember a patient, let's call her Joan, who came to see me after months of struggling with poor sleep. She was in her late 60s and had always been a vibrant, active woman, but something had changed. She described her sleep patterns, saying, "I fall asleep just fine, but then I wake up at 2 a.m., feeling like I've been shot out of a cannon. I just lie there for hours, waiting for morning." Her lab tests were normal, but when I asked about her intimacy habits, she hesitated before telling me, "That part of me is over." What Joan didn't realize was that the act of self-intimacy plays a crucial role in regulating the hormones necessary for deep restorative sleep. During orgasm, your body releases a combination of oxytocin, prolactin, and endorphins, natural chemicals that not only make you feel good, but also help your body transition from a state of alertness to rest. At the same time, cortisol, the hormone responsible for stress and wakefulness, drops significantly. This chemical cocktail is nature's way of signaling your body to relax, unwind, and prepare for deep sleep. When you stop engaging in self-intimacy, you remove one of the natural triggers that help your body relax and sleep soundly. Instead of the calming hormones, you're left with the restlessness and tension that make sleep harder to come by. For many women, this leads to disrupted sleep patterns, waking up in the middle of the night, or not feeling rested even after a full night of sleep. Some turn to sleeping pills, while others accept sleep deprivation as a normal part of aging. But poor sleep is not just about feeling tired. It's a gateway to a host of other health issues. Chronic sleep deprivation has serious consequences. It weakens your immune system, accelerates cognitive decline, and raises the risk of heart disease. In older women, it also contributes to memory problems and a loss of independence. I've seen patients who once lived active, engaged lives become withdrawn simply because they were too exhausted to function. And many of them didn't realize that their sleeplessness was linked to the absence of self-intimacy in their lives. One of my patients, a woman in her late 60s, told me that after reconnecting with this part of herself, she felt like a new person. "I sleep like I did 30 years ago," she said. "I didn't realize how much I needed that release. I thought I was just getting old." She had no idea that reconnecting with her body would lead to such profound changes, not just in her sleep, but in her energy levels and mood. But the impact of poor sleep goes beyond feeling tired. It affects your ability to think clearly, your emotional health, and even your immune defenses. The body needs deep, uninterrupted sleep to restore itself, fight off infections, and prevent disease. Without it, your body becomes vulnerable. I've seen women whose health deteriorated not because of any major illness, but simply because they were too tired to take care of themselves properly. If you're still with me and find these insights valuable, please leave a comment to let me know you're engaged. It helps me tailor future content that best supports your health journey. As we move forward, it's essential to recognize that the benefits of self-intimacy extend far beyond sleep. The next area we'll focus on is how neglecting this vital part of yourself can affect your circulation, muscle tone, and overall pelvic health. Many women experience muscle weakness balance issues and even urinary incontinence as they age. These changes often seem like an inevitable part of growing older, but they are in fact largely preventable by maintaining pelvic floor strength. In the next section, I'll explain how the pelvic floor circulation and overall muscular health are connected to self-intimacy, and why regular stimulation plays a key role in keeping your body strong, vibrant, and functional. As we near the end of our conversation, it's essential to understand how the neglect of self-intimacy impacts your pelvic health, circulation, and muscle strength. Many women experience weakening pelvic muscles, loss of balance, and bladder control issues as they age. These changes often seem like just a part of growing older, but the truth is, they are largely preventable with regular, simple actions that promote pelvic floor health. Let me share the story of Barbara, a retired teacher in her 70s. She came to see me because of a feeling of heaviness in her lower abdomen and mild urinary leakage, which she had never experienced before. "It's strange," she told me. "I feel like the foundation of my body is slowly giving out." Her pelvic floor muscles, which are responsible for supporting the bladder bowel and reproductive organs, had weakened over time. This isn't just about inconvenience, it's about your body's foundational strength. Without proper attention, these muscles can atrophy, leading to conditions like urinary incontinence, constipation, or painful intimacy. What Barbara didn't know was that regular sexual stimulation, including self-intimacy, plays a crucial role in keeping the pelvic floor muscles engaged and active. The act of orgasm causes the pelvic floor muscles to contract rhythmically, essentially providing a workout for them. This contraction helps improve blood flow, maintain muscle tone, and keep the tissues in the pelvic region strong and resilient. It's not about performance, it's about function. When you stop engaging in self-intimacy, these muscles become weaker over time, leading to issues like bladder leakage, pelvic organ prolapse, and even discomfort while standing or walking. I've had many patients who experience embarrassment and frustration over these issues, not realizing that they can be prevented by simple, regular self-care. Now, the truth is, not all women are aware of the deep connection between sexual health and overall physical function. It's easy to assume that these changes are just a normal part of aging. But I want to stress something very important. Your body still wants to function well, even as you age. One of the most natural, effective ways to support your pelvic floor health is through self-intimacy. It strengthens the muscles, promotes circulation, and helps keep the tissues healthy and responsive. It's a powerful natural tool you have at your disposal. I've had patients who felt ashamed of needing to rely on pads or special undergarments, or who avoided physical activities because they feared bladder leakage. What they didn't realize is that neglecting self-intimacy was contributing to their pelvic floor weakening. The longer this is ignored, the harder it is to reverse. But with simple changes, like regularly stimulating your body, you can restore strength, improve circulation, and regain control over your pelvic health. Finally, as we wrap up, it's crucial to understand the broader effects that sexual health, including self-intimacy, can have on your immune system. When you engage in self-intimacy, your body produces biochemicals that enhance immune function. During orgasm, your body releases immunoglobulin A IgA, a key antibody that helps defend against viruses and infections. This is especially important as you age, as the immune system naturally weakens over time. By neglecting self-intimacy, you're depriving your immune system of a natural boost. The results: more frequent illnesses, slower recovery times, and an overall decrease in your body's ability to fight off infections. I've seen many women who stop engaging in self-intimacy and find themselves more susceptible to colds, flu, and even chronic conditions like inflammation. The immune system needs regular stimulation to remain strong, and self-intimacy provides just that. It's easy to dismiss this as a topic that doesn't matter as much as we get older. But the reality is, taking care of your sexual health is essential for maintaining your overall vitality. It's not about indulgence or vanity, it's about self-respect, dignity, and the natural functioning of your body. The changes I've discussed today, the effects on your pelvic health, emotional well-being, sleep quality, circulation, and immunity, are not just symptoms of aging. They are signs that your body is asking for care, and they are preventable or manageable with simple, consistent habits. I want you to hear this clearly. Your body is not finished, not obsolete, and it's certainly not beyond care. By reconnecting with yourself through self-intimacy, you're not just maintaining sexual health, you're preserving your mental, emotional, and physical health. You're saying to your body, I am still here, I am still worthy of care, and I still deserve to feel good. If you've forgotten this part of yourself, or felt embarrassed to reconnect with your body, I invite you to reconsider. Reconnect with yourself, not because you are trying to hold on to youth, but because you are choosing to honor the life that is still within you. Start small with curiosity and kindness, but most importantly, start. You deserve to live fully in every sense of the word. If this message resonated with you, I encourage you to share it with other women who may benefit from this information. Leave a comment below to share your thoughts, and don't forget to subscribe for more insights into how you can live a long, healthy, and fulfilling life. Your health matters, and your voice can make a difference in someone else's life.